Typically, birth occurs about 38 weeks after fertilization. Birth marks the transition from prenatal to postnatal development. Oxytocin, produced by the hypothalamus and stored in the posterior pituitary gland, prompts uterine contractions. The birth process is a positive feedback cycle in that the uterine contractions facilitate more oxytocin being released, which facilitates stronger uterine contraction, and the birth process itself will shut this positive feedback cycle down. Labor is triggered by oxytocin with an interdependence to estrogen receptors. Labor is just the term used to describe the process by which the fetus is expelled from the uterus, and it occurs in 3 stages: dilation, expulsion, and placental. The dilation stage begins with the onset of contraction and continues until the cervix is fully dilated, typically 6 to 7 hours. The dilation stage may be shorter in women who have previously given birth. In the expulsion stage, this begins with full dilation of the cervix and ends with delivery of the baby, which may last 1 or more hours. During the expulsion stage, the umbilical cord is cut, the newborn takes its first breath, and conversion to fetal circulation begins for the infant. The placental stage ends with the delivery of the baby. Thus, it ends when the placenta is expelled from the mother's body approximately 15 minutes after birth. And so through the steps, the images in your textbook, dilation stage begins with the onset of regular contraction and ends when the cervix is dilated. Expulsion stage begins with full dilation of the cervix and ends with the delivery of the baby. Placental stage begins with the delivery of the baby and ends with the expulsion of the placenta. Most babies are born head first, facing the vertebral column of their mother. Some are born buttocks first, which is a breech birth and associated with difficult labor and delivery. Breech births are also associated with umbilical cord accidents. So physicians attempt to turn the baby into the head first position. If not, they may perform cesarean section to deliver the infant. Stage of development at birth, a baby is considered full term if it's born at least 38 weeks after fertilization. Full-term infants typically average around 7.5 pounds of weight. Some may even be born 1 or more weeks late. Premature infant is a baby born before 37 weeks of gestation. Survival rates increase with the time in the womb. Typically don't attempt to save infants at 22 weeks or less because even with intensive medical care, major disabilities are inevitable. The average of such infants is approximately 1.4 pounds. Babies at 25 weeks weighing 2.2 pounds have a 50 to 80% chance of survival with intensive care. Birth defects or developmental defects that present at birth may be structure, function, behavior, or metabolic. Causes might be genetic, such as changes in the number or the structure of the chromosomes, may be due to environmental agents such as teratogens or anything that causes abnormalities. Teratos means monster. Teratogens could be drugs, chemicals, radiation. Teratogens could also include certain viruses such as rubella or herpes simplex. Teratogens cause major defects during critical periods of rapid cell differentiation, most during the pre-embryonic period. This is when the cells and tissues acquire specific functions and organs are formed. So this shows the table in your textbook of the timing of different developmental stages, where you can see that the central nervous system between weeks 3 and 16 is a critical period. The central nervous system has the longest critical period. Upper limbs are shorter critical period, week say 4 to 6. Chromosomal imbalances also account for a large percentage of spontaneous abortions. So you can see that the central nervous system is one of the first organ systems to develop. Lactation is production and ejection of milk from the mammary glands. From Chapter 10, we studied the hormones. Prolactin from the anterior pituitary gland promotes milk production, while oxytocin, produced by the hypothalamus and stored in the posterior pituitary gland, stimulates milk ejection. So oxytocin is responsible for both uterine contractions as well as milk ejection in nursing. Milk production does not occur during pregnancy because high levels of estrogen and progesterone inhibit prolactin production. After birth, though, when the estrogen and progesterone decline, when the placenta is lost, prolactin will initiate milk production. Typically, the milk is produced after 3 days. Initially, it's colostrum. At weaning, when suckling in, so does the production of prolactin. The colostrum in milk nursing is preferred for infants because they contain antibodies that help to boost the infant's immune system. Colostrum is immediately produced after birth, milk not till about day 3. Breastfeeding benefits for mother is that it helps the mother's uterus return to a pre-pregnant size. Oxytocin release helps the uterus to shrink. Breastfeeding is also energetically expensive, so it helps with the mother's returning to her pre-pregnancy and supports weight loss, as well as it's associated with offering some protection to the mother from breast cancer. The postnatal period is the period of growth and development after birth. Stages is infancy, birth to 12 months, childhood 13 months to 12 to 13 years, adolescence is puberty to late teens, and adulthood is generally reached by age 20 or 21 years of age. Aging is a normal and progressive decline in the structure and function of the bodies of adults. Changes to organ systems gradually occur. And in your textbook, there is a whole table of changes that occur with aging, and this is just a normal process of development. Some possible causes of aging is changes in critical organ systems, cell division ceasing. From Chapter 21A, you may recall reading about telomeres, where the telomeres shorten. There could be damage to DNA and other macromolecules. Glucose has been shown to cause proteins such as collagen to form cross-linkages, stiffening connective tissue, including heart muscle. There's a reduction in growth hormones. as we age. Also, we acquire mutations possibly in our genes. So the genes, environment, and lifestyle all determine the human lifespan. Aging is most likely the result of multiple